Welcome back and welcome to another lecture from CyberMD. Today we will be discussing the topic of multifocal atrial tachycardia as it applies to the USMLE STEP 1 exam as well as to clinical practice. Multifocal atrial tachycardia is a type of heart arrhythmia that is caused by multiple ectopic foci, sources of electrical impulses, in the atria. This results in an irregular heart rate and rhythm with at least 3 distinct P-wave morphologies or shapes on an EKG. In a normal heart rhythm, the P-waves are uniform in shape and signal that the atria are contracting in a coordinated manner. However, in multifocal atrial tachycardia, the irregular P-wave shapes indicate that the atria are contracting in an uncoordinated manner from multiple ectopic foci. In terms of symptoms, individuals with multifocal atrial tachycardia may experience palpitations or noticeable fluttering or racing sensation in their chest. They may also experience shortness of breath, fatigue, and chest pain. However, it is important to note that some individuals may not experience any symptoms at all, making it important to seek medical evaluation if there is any suspicion of the arrhythmia. This condition is often associated with underlying medical conditions such as COPD, pneumonia, and heart failure. COPD is a group of lung diseases that causes breathing difficulties and is often caused by smoking. Pneumonia is an infection in the lungs that can cause inflammation and fluid buildup, while heart failure is a condition where the heart is unable to effectively pump blood throughout the body. All of these underlying medical conditions can weaken the heart and increase the risk of arrhythmias such as multifocal atrial tachycardia. Additionally, smoking is considered a risk factor for multifocal atrial tachycardia. Treatment for multifocal atrial tachycardia may involve a combination of medications, electrical therapy, and in some cases, surgical procedures. Medications used to treat multifocal atrial tachycardia include beta blockers and calcium channel blockers, which slow down the heart rate and help to restore normal heart rhythm. Electrical therapy, such as electrical cardioversion, involves using electrical shocks to restore normal heart rhythm. In severe cases, surgical procedures such as ablation may be necessary. Ablation involves destroying small areas of heart tissue that are responsible for the arrhythmia, helping to restore normal heart rhythm. In conclusion, multifocal atrial tachycardia is a type of heart arrhythmia caused by multiple ectopic foci in the atria that leads to an irregular heart rate and rhythm with at least 3 distinct P-wave morphologies on EKG. It is often associated with underlying medical conditions such as COPD, pneumonia, and heart failure, and may cause symptoms such as palpitations, dyspnea, fatigue, and chest pain. Treatment for multifocal atrial tachycardia may involve a combination of medications, electrical therapy, and in some cases, a surgical procedure such as an ablation. Thank you for tuning in, and please be sure to like, comment, and subscribe to our content so that we can continue to provide free medical education for students around the globe.